Okay. All right. Welcome to our Thursday, October 19th, Thursday, 4 p.m. class. We're going to do review. We already did chapter 18 on Tuesday, a review. So today we're going to do 19, 20, and 21. So this is strictly a review for your exam. Your exams are on chapter 18, 19, 20, and 21. Your exam is approximately 57 questions. So it's covering 4 chapters. Majority of it is multiple choice. You will have to look up a few codes, but not many. Majority of the exam is true, false, and the rest is multiple choice and a few coding that you would have to look up. Because by it being 4 chapters, I want to make sure that you all have a review. And if you all can, try to save these questions because a good bit of these questions are on your NCCT exam. So, if you can, try to take a picture of it or save it, because this will be very helpful for you as well when it comes time to that NCC certification on how the setup is. So we're going to go ahead and get started. Chapter 19, we did chapter 18 on Tuesday. So make sure I sent you all, I've been sending a link in the email, the Unitech email, as well as putting it in your Zoom class in the grade section of e-learning. So if you're missing it in one place, you can get it in another. So we're going to go ahead and get started. Chapter 19. The mucosal and submucosal tissues of the lips and cheeks are included in the oral cavity. True or false? The mucosal and submucosal tissue of the lips and cheeks are included in the oral cavity. True or false? This is in chapter 19.
False. That'd be like under skin.
No, listen, what is the mucosal? So that's your mucus. And your submucosal tissue of the lips and cheeks are included in the oral cavity. True or false?
True.
That's true, because the mucus in your cheeks and your lips, that's inside. That's your oral cavity. So that is true. Next. When a colectomy is performed, a segment of the stomach is resected and an anastomosis is performed between the remaining ends. When a colectomy is performed, a segment of the stomach is resected and an anastomosis is performed between the remaining ends. True or false?
False.
That's false. That is false. Because first of all, a colonectomy has nothing to do with the stomach when they're doing anything.
Yeah.
Next. The correct code for an intraoperative colonic lavage is 44701. So do you all have your manuals? The correct code for an intraoperative colonic lavage is 44701. Remember, we're in chapter 19. The correct code for an intraoperative colonic lavage is 44701.
That's true.
Or false? Huh?
That's true.
That is true. Next one. With the exception of incisional and ventral hernias, the use of mesh or other prosthesis is not separately reported when performing hernia repairs. True or false?
I'm good, thank you, man. Yeah.
With the exception, that's that key word, with the exception of incisional and ventral hernias, the use of mesh or other prosthesis is not separately reported when performing hernia repairs. True or false?
True.
That is true. That's a student texting. That is true. Next. Code 45999 is the correct code to report an unlisted laparoscopic procedure of the anus. Code 45999 is the correct code to report an unlisted laparoscopic procedure of the anus. True or false?
Is
You
it
said
true?
45999 of the anus.
Yes, code 45999 is the correct code to report an unlisted laparoscopic procedure of the anus.
That's false.
Yeah,
That
that's
is false.
false.
Yes, that is false.
The correct code would be
45499.
What is the correct one you said, Jerry?
45499.
Right. You see how they changed that to 45999?
Uh-huh.
That's how it's usually done in on your certification exam. So you have to, like, you might say, oh, that is correct, but you have to pay attention because it might just be one number that they misplaced. Next. If totally unrelated to the condition requiring critical care code 43752 can be coded with the critical care codes. If totally unrelated to the condition requiring critical care code 43752 can be coded with the critical care codes. True or false? If it's totally unrelated to the condition requiring critical care code 43752, can it be coded with the critical care codes?
that would be false.
No.
It's true. I'm sorry.
Look up that code.
43752, right?
43752. If totally unrelated to the condition requiring critical care code 43752, can it be coded with the critical care codes? That is true.
Oh,
Do
I
not
didn't read
report
that part.
43752 in conjunction with critical care codes.
Mhm.
It says it right underneath it. Be right back, guys.
Yes. Next one. A common abbreviation for a procedure code 43260 endoscopic retrograde cholangiopancreatography is ERCP. True or false? A common abbreviation for a procedure code 43260 endoscopic retrograde cholangiopancreatography is ERCP. True or false?
True.
True.
That's true.
Yes, that is true. Next. A gastrostomy tube is placed inside the stomach for A, draining peritoneal fluid, B, draining urine, C, feeding purposes, or D, a weight loss measure. A gastrostomy tube is placed inside the stomach for A, draining peritoneal fluid, B, draining urine, C, feeding purposes, or D, a weight loss measure?
Is it C?
C, correct, for feeding purposes. Next. The first step in choosing the correct digestive endoscopic procedure code is to identify the blank of the procedure. The first step in choosing the correct digestive endoscopic procedure code is to identify the blank of the procedure. A, extent, B, complexity, C, urgency, or D, position. The
Is
first,
it complexity?
not complexity. The first step in choosing the correct digestive endoscopic procedure code is to identify the blank of the procedure. This is an endoscopic procedure. Is to identify the blank of the procedure. A, extent, B, complexity, C, urgency, D, position. So we know it's not B, we know it's not complexity.
Would be position?
Not position. So we know it's not complexity or position.
Then be extent.
Yes, extent. So with the endoscopic procedure is to identify the extent of the procedure. Next. Plastic. So you need your coding manual, your CPT manual. Plastic repair of the cleft lip nasal deformity, primary bilateral, one of two stages. What is the CPT code? Plastic repair of the cleft lip nasal deformity, primary bilateral, one of two stages. What is the CPT code?
40702.
Exactly. How did you know that fast, Jared?
Because I was already on that page.
Okay, so see, that's a good hit there. You know that's on the exam. So look, Jared, please don't get that one wrong here. Next. A diagnostic transoral flexible esophoscopy was performed. A diagnostic transoral flexible esophoscopy was performed. During the procedure, an esophageal polyp was found and removed by hot biopsy forceps. What is the CPT code? A diagnostic transoral flexible esophoscopy was performed. During the procedure, an esophageal polyp was found and removed by hot biopsy forceps. What is the CPT code? A diagnostic, transoral, flexible esophagoscopy was performed. During the procedure, an esophageal polyp was found and removed by hot biopsy forceps. What is the CPT code?
What, baby? Hey, ask Daddy to help you, okay?
What you want, baby? Give it here.
Is it 43194?
No, you're close. The 4-3 is correct. A diagnostic, transoral, flexible esophagoscopy was performed. During the procedure, an esophageal polyp was found and removed by hot biopsy forceps. What is the CPT code?
43216.
Correct. 43216. Chapter 20. The urinary system subsection is first arranged anatomically. True or false? The urinary system subsection is first arranged anatomically. True or false?
True.
Yes, that is true.
Isn't majority of the sections arranged anatomically?
A good bit of them, the body systems, yes.
Yes.
A vasectomy is performed for the purpose of sterilization. True or false?
True.
True.
That's true. A common abbreviation for a transurethral electrosurgery of the prostate is TURP. True or false? A common abbreviation for a transurethral electrosurgery of the prostate is TURP. True or false?
True.
True.
No, it's not.
It's false.
That is false. Look at the abbreviation. Transurethral, look at that E, electrosurgery of the prostate. That's what I'm saying. You have to pay attention to those words. Transurethral electrosurgery of the prostate. So what should it be? What is the abbreviation for it?
TUEP.
Correct. Next.
I got confused for a minute. Then again, it doesn't take much.
One of the most common conditions of the prostate is BPH. True or false? One of the most common conditions of the prostate is BPH. True or false?
Is that true?
That's true. Next. The insertion and removal of a temporary stent during diagnostic or therapeutic cystoscopic interventions is included in 52320 through 52355 and not reported separately. True or false? The insertion and removal of a temporary stent during diagnostic or therapeutic cystourethrostopic intervention is included in 52320 through 52355 and not reported separately. True or false? The insertion and removal of a temporary stent during diagnostic or therapeutic cystourethrostopic intervention is included in 52320 through 52355 and not reported separately. True or false?
That would be false.
No. Look at that
It's
code.
true.
That is true. Look at the code range of 52320 through 52355. That is not reported separately.
Oh, okay, I see.
Next. When coding 51797, it is necessary to add a modifier -51. Is that true or false? When coding 51797, it is necessary to add a modifier 51. True or false?
That would be true.
No, are you looking at 51797?
Yeah.
When coding 51797, it is necessary to add a modifier 51. That is false. What does it say for code 51797?
In conjunction with 51728 and 51729.
You said 28,
I said both of them.
but I said 51797.
That's what I'm looking at right now. Oh, wait, that's
Sorry, what'd you say, Misty?
that is a part of that is a modifier, I think.
So
51797.
it says
It
when
says list. It says list separately in addition to code for primary procedure.
right, when coding 51797, it is necessary to add a modifier 51. So that says the answer was true or false.
It was false. I'm
So
sorry.
that's false. Yeah, that's false. Next. Code 54699 is the correct code to report an unlisted procedure of the male genital system. Code 54699 is the correct code to report an unlisted procedure of the male genital system. True or false?
False.
That is false. Next. When urodynamics are performed and the physician only interprets the results, the correct modifier would be A, 79, B, 26, C, TC, or D, 54. Remember, your modifiers are in the front cover of your CPT manual. When urodynamics are performed and the physician only interprets the results, the correct modifier would be A, 79, B, 26, C, TC, or D, 54.
It's the 26.
Yes, B, 26. Next one. To report the cystourethrostopic removal of a self-retaining indwelling ureteral stent, the correct code would be 52310 or 52315. What modifier would be applied? A, 25, B, 57, C, 58, or D, none are correct. To report the cystourethrostopic removal of a self-retaining indwelling ureteral stent, the correct codes would be 52310 or 52315. What modifier would be applied? A, 25, B, 57, C, 58, or D, none are correct.
It'd be 58.
Yes, 58 is correct. An installation procedure of the bladder is performed for treatment of A, obstruction, B, BPH, C, bladder cancer, or D, pain. An installation procedure of the bladder is performed for treatment of A, obstruction, B, BPH, C, bladder cancer, or D, pain.
It's bladder cancer.
Correct. C, bladder cancer. When lithotripsy is performed, the patient may be surrounded by A, people, B, liquid, C, stones, or D, gel. When lithotripsy is performed, the patient may be surrounded by A, people, B, liquid, C, stones, or D, gel. When lithotripsy is performed.
Is it stone?
No, not stone.
Is it liquid?
Yes, it's B, liquid. Next. What do the letters in UPP stand for? What do the letters in UPP stand for? A, urethral positive positioning. B, urodynamic penetrating pressure. C, urethral pressure positioning. Or D, urethral pressure profile. What do the letters in UPP stand for? A,
It's D.
D is the answer, urethral pressure profile. The semen analysis following a bilateral vasectomy. A semen analysis following a bilateral vasectomy. What is the CPT code? A, 55250, B, 55300, C, 55250 times 2, or D, no codes assigned. The semen analysis following a bilateral vasectomy, CPT code is A, 55250, B, 55300, C, 55250 times 2, or D, no codes assigned.
Is it 55250?
No,
No. Oh.
the semen analysis
Semen analysis.
following a bilateral vasectomy. A, 55250. No, we know that's not it. B, 55300. C, 55250 times 2. And D, no codes assigned.
Would it be 55250 times 2?
No, ma'am.
There's no codes are found.
Yes, no codes assigned. So one more before we go to chapter 21. A nephrectomy with a total uteroectomy and bladder cuff through different incisions. What is the CPT code? It's no A, B, C, and D. I need you all to tell me the code. A nephrectomy with a total uterectomy and bladder cuff through different incisions. What is the CPT code? Nephrectomy is NEPHRECTOMY. NEPHRECTOMY. A nephrectomy with a total uterectomy and bladder cuff through different incisions. You were saying something, Jared?
No.
Oh, okay. a nephrectomy with a total uteroectomy and bladder cuff through different incisions. What is the CPT code? A nephrectomy with a total uteroectomy and bladder cuff through different incisions.
Is it 50236?
That is correct, Ashley.
Yay!
Yes, yes. So now, chapter 21. Okay, number 1. Colopotomy is an incision into the vagina. True or false? Colopotomy or colopotomy is pronounced different ways. Colopotomy or colopotomy is an incision into the vagina. True or false?
True.
That is true. A radical vulvoectomy is the removal of greater than 80% of the vulval area. True or false? A
Repeat it one more
radical,
time.
a radical vulvectomy is the removal of greater than 80% of the vulvar area.
That's false.
That is false. Next, diagnostic amniocentesis includes radiologic supervision and interpretation. True or false? Diagnostic amniocentesis includes radiologic supervision and interpretation. True or false? Misty, you're just rubbing your head and rubbing your head, Misty.
It's only
You
the
said-
talk because I can't really look into the book, so
You said that it needs radiologic guidance?
Yeah, diagnostic amniocentesis includes radiologic supervision and interpretation. True or false?
True.
No, not true. So that means it's false. It says diagnostic and amniocentesis includes radiologic supervision and interpretation. That is false. It does not need supervision and interpretation. Next, reporting code 59300 is acceptable when reporting 59400. True or false? Reporting code 59300 is acceptable when reporting 59400. True or false?
I'm gonna say false.
Would you say, Misty?
False,
That is false.
because it has nothing to do with each other.
Right. Next. The code for destruction of a vaginal lesion is 17000, which is 17,000. The code for destruction of a vaginal lesion is 17,000. True or false?
False.
That is false. Surgical laparoscopy always includes A, diagnostic laparoscopy, B, paracervical block, C, biopsy, or D, all are correct. Surgical laparoscopy always includes A, diagnostic laparoscopy, B, paracervical block, C, biopsy, or D, all are correct.
I'm gonna go with D. All are correct.
No, ma'am.
No, ma'am. Okay.
Surgical laparoscopy always includes A, diagnostic laparoscopy, B, paracervical block, C, biopsy, or D, all are correct.
Is it biopsy?
No, ma'am. So we know it's not biopsy and it's not all are correct.
Thanks to my mouth.
We're ruling out. So, that's how you do. You have to rule out.
Is it diagnostic laparoscopy?
Right. So remember, whenever you're doing a surgical procedure, you have to do a diagnostic first. So it's going to be diagnostic laparoscopy. It's always going to include a diagnostic first.
I might as well just dye my hair blonde.
What are you trying to say? What are you trying to say? I know you see my hair's blind.
I had a blonde moment. Sue me.
Our boyfriend's laughing too at you.
Ashley's boyfriend, it ain't that funny.
That is terrible to say blind. So I already know what you're trying to say, Misty. Anyway, for medical complications of pregnancy, the physician will report his additional professional services using codes from what section or subsection? For medical complications of pregnancy, the physician would report his additional professional services using codes from what section or subsection? A, medicine, B, EM, which is evaluation and management, C, female genital system, or D, maternity care and delivery.
On the EM.
Correct. EM under evaluation and management, because it's a medical complication of pregnancy. That's going to be evaluation and management.
Because you evaluate and you manage.
Right. The anatomy in the female genital system subsection starts with the vulval and progresses upward to the A, fallopian tube, B, uterus, C, ovary, or D, perineum. The anatomy in the female genital system subsection starts with the vulva and progresses upward to the A, fallopian tube, B, uterus, C, ovary, or D, perineum.
Is it D, perineum?
No, ma'am.
No, it's the ovary.
Yes. Now, how y'all looking with this one? How you letting a male answer this question?
I was going
Don't
to
do
say
that. Don't do that. Don't do that.
Look, I had to comment on that one. Alice, you said you about to say ovary? Or about the male?
Hey, do it.
I'm hiding my face right now.
Yeah, we can't. Come on now. We can't have the male knowing more about our body than we do. It's ridiculous. So I'm gonna have to find a male one to see if it's females know the male body.
I'm
Next,
sure we do.
according to the text, vulvectomy codes are divided based on the blank and extent of vulvar area removed during the procedure. According to the text, vulvectomy codes are divided based on the blank and extent of vulvar area removed during the procedure. A, complexity. B, status, malignant or premalignant lesions. C, size, or D, recurrence. According to the text, vulvectomy codes are divided based on the blank and extent of vulvar area removed during the procedure. A, complexity. B, status, malignant or premalignant lesions. C, size, or D, recurrence.
The size.
Correct. C is size.
I was just about to say that.
Okay. Next. Hysterectomy codes are first divided in the CPT manual based on the blank and then on any secondary procedures that were done. Hysterectomy codes are first divided in the CPT manual based on the blank and then on any secondary procedures that were done. A, approach. B, severity. C, duration, or D, patient age.
Is it severity?
No, ma'am.
It's approach.
You know what, y'all? I'm not gonna eat. No. Y'all, look, and I have to comment on this. We will not, sorry, Jared, but look, we will not let a male describe and know our body better than we do. We cannot let this happen.
I'm a study
How about
extra.
you know we reading up on female genitalia? I have a valid point.
Next. In which of the following categories would you locate a code for the removal of an IUD? In which of the following categories would you locate a code for the removal of an IUD? A, removal. B, introduction. C, manipulation, or D, excision. In which of the following categories would you locate a code for the removal of an IUD? A, removal. B, introduction. C, manipulation, or D, excision.
It's the introduction.
Yes, introduction. B. Next. Lysis, some people say lysis, some say lysis, of adhesions is performed on either the fallopian tubes or the blank. Lysis of adhesions is performed on either fallopian tubes or the blank. A, vagina. B, uterus. C, ovaries, or D, vulva. Lysis of adhesions is performed on either the fallopian tube or the A, vagina. B, uterus. C, ovaries, or D, vulva.
Ovaries?
Ovaries is correct. There we go, Ashley. We have to come back. We have to. Next. You would expect to quote a service for an amniocentesis using a code from the female genital system subsection and a code from the blank section. A, medicine, B, anesthesia, C, radiology, or D, EM section, which is evaluation and management. You would expect to code a service for an amniocentesis using a code from the female genital system subsection and a code from the blank section. A, medicine, B, anesthesia, C, radiology, or D, EM.
I want to say it's anesthesia.
No, ma'am.
I give up.
No, don't give up. This is how you get better. You don't give up. You keep going. You would expect to code a service for an amniocentesis using a code from the female genital system subsection and a code from the blank section. Medicine, radiology section. Because remember, with an amniocentesis, they have to do radio. That was in one of the other chapters, remember? So
Oh.
yes. If a patient has had a previous cesarean delivery and then has a vaginal delivery, the correct code would be A, 59618, B, 59400, C, 59410, or D, 59610. If a patient has had a previous cesarean delivery and then has a vaginal delivery, the correct code would be A, 59618, B, 59400, C, 59410, or D, 59610.
59618.
Bump.
What do you mean bump?
Wrong answer.
Huh? Yeah, you said a vaginal delivery after a cesarean?
No, if a patient has had a previous cesarean delivery and then has a vaginal delivery, the correct code would be, so we know it's not 59618. So now
59610?
Correct. 59610. Our last one. A fetal non-stress test is completed on a 36-week pregnancy. The correct code would be A, 59050, B, 59012, C, 59020, or D, 59025. A fetal non-stress test is completed on a 36-week pregnancy. The correct code would be A, 59050, B, 59012, C, 59020, or D, 59025.
59025.
Correct. So, as I stated on Tuesday, we have some studying to do.
You can't blame me. I wasn't here on Tuesday.
That has nothing to do with it, mister. You're still supposed to be reading and doing your assignments and reading your PowerPoint slides.
I was having a rough day. Like, my fiance had to literally calm me down. My anxiety was getting to me.
Understood, but guess what? You have until Sunday to take this exam, and it is 57 questions. So I need you all to go through chapter 18. You can go back and look at that Zoom class. We went over we did a review on chapter 18. You can constantly review this video the information that we're going on is on your test. It's on your exam. So reading through those PowerPoint slides, knowing the sections to look through, you know, that helps. Knowing the code ranges to look through, going back and reading the PowerPoint slides. Like I said, the PowerPoint slides breaks everything down. Going through your theory questions, because a lot of those theory questions and in your workbook, those are the questions and things that are used for your exams. So I said, like I always say, don't just get the answers out the back of the book. Use the answers in the back of the book as a reference. So when they have a code and you get that answer, find that code in your manual so that you'll know how to use it. And I mean, it's helpful, but not just never checking in the manual and just writing down the answer. That's not going to help you when it comes to that certification exam. Use it as a reference. Okay, if you don't know how to do it, look, get that code from the answer out the back of the book. Then go and find that code in the manual, looking at the words that they use to find it, and then you doing one on your own. That's the only way it's going to help you to be able to find those codes. So continue to read. Like I said, you do not have to do that exam today. We did our review. It's open for today, but you have until Sunday. Remember, next week is the last week in this module. We'll be moving on to module 155. I have a lot of graduates that'll be finishing in the beginning and the middle of module 155. So kudos and congratulations to those who will be graduating soon. So, and then I know, Ashley, you're one of them. You'll be graduating real soon. We have several others that will be graduating real soon, which I wish much success, and I'll be sending out information for you all in that aspect as well. But remember, I will not, I've said this on every video, I will not be opening emails next week. Your exam is 57 questions. You're not my only class. I have other classes and I have independent study classes. So come Sunday, that's the last day I will be reopening any missed assignments, labs, or exams. I have been saying this since the beginning of the chapter. I've given ample enough time for everybody. If you're missing anything, to inform me so I can reopen things. I cannot do it next week. It's impossible. Plus, I have to get everything ready for the next module because it starts in the middle of next week. So please, if you need assignments reopened, if you need labs reopened, if you need exams reopened, now is the time to inform me. And also, for those of you who have your extra points, if you want to use those extra points for now, or if you want to carry them over, you're fine. You don't have to tell me anything. But if you want to use those extra points that you have for an assignment, to add it to a lab, to add it to an exam, you can do that as well. So please make sure you let me know that. If you can still let me know this week, because then I can add it to your lowest grade. Remember, your lowest grade will always be dropped. I do drop your lowest grade regardless. But if you have a lower grade, like in a daily assignment, a lab for your exam, and you need points added, please let me know. Also, I have to keep informing you all. When you all are doing your daily assignments and your labs and you see that you're not getting 100, I do read the answers. I do read the assignments. Yes, Jerry, you came off mute real fast.
What was the answer for the daily assignment for yesterday?
The vulva being dry.
Okay, all right.
Yeah, and a lot of people had urine flow.
Yeah.
You see how I remember? You see how I know the answer? Straight off the bat?
When I looked for it, that was the only thing that I didn't see was the urine flow. So, because when I went to check my thing, I was like, wait, my average looked different. So when I went back, I was like, oh, that's because I got the question wrong.
So, but you see how I knew the answer?
Yeah.
I read the questions and I read the answers. So just because you are putting assignments in doesn't mean you have to answer the questions. I have people that just put information in and it's something from another chapter. So that's very time consuming for me to read those questions and answer. So just because you do an assignment and you put anything, that's not helping you, because you need to know the correct answers. And I mean, if it's wrong, I'm letting you know. So if you have time, I know everybody's busy, you can go back and research and find the correct answer as well. Then when, you know, if you have questions like you just did, we can review if you had something marked wrong, or you can send it to me in an email, what is the correct answer, and I can respond. Because just doing
I actually have a
assignment,
funny story.
okay, just putting the answer in, I mean, a question, and you're putting something totally different, you will see, like I do check. I have people who do part of the assignment, and then I will respond and saying, can you send me the other part of the assignment? You only answered part one. It was 2 parts. So I do read all of the information. I do look at the correct answers. And when you submit assignment, if it's wrong, if it's completely wrong, I'll send you a message. But if you attempt, I still give you credit. I don't just give you a 0. But it has to be that, you know, if it's A, B, C, D, and you had B and it was D, I'm not going to give you a 0. You know, so you're still going to receive credit. But if it's a question I'm answering, then the answer is totally wrong, I'm going to send you a message saying this answer is incorrect. Please resubmit. So, and like I said, that's very time consuming, especially when, you know, you have several classes that you're going through and doing this. So I do, like I said, I do read the questions. I do read the answers. I do know the answers. And then for the ones that when I'm doing a lot, I have my sheet on the side with my thing with the answers written down, so I can make sure that I'm correcting and putting the right answers. Misty, what you said?
So I kind of got a funny story about the assignments and labs.
Uh-huh.
So the one lab that you gave us with all the reports.
Mm-hmm.
So the first one, it was 44. And I was like, okay, I'm going to go to report 44. I start reading. I'm like, man, this doesn't look like anything that we're in right now. It like went to the eye. So I'm like, okay, something's not right. Let me go back and see if maybe I just read it wrong. So I look at question 44. It's not report 44. It was report 22, I think.
Yeah.
So yeah. When I realized what I did, I was like, oh, okay. Makes sense now.
Mm-hmm.
I did the same thing, because when I I'm like, wait, this is supposed to be about the male system or the female system or something like that. They're talking about ocular something. And I was like, wait.
That's
no,
exactly what I did. Like, no lie. I started reading. I was like, man, this is about the ocular. We're not even in this system yet.
Yeah, so see how they say you have to read and pay attention. You have to look through it to make sure you're in the area. But then see, that was great because you all knew that we were not doing anything with the eyes at the time. So that made you say, well, let me go back and reference what we're actually doing. So this is not right. So I mean, that's research, you know, and going back and checking and knowing that you're not in that system, just not putting, because you saw report 44 and you just put that down, you know. And you know in good well we're not dealing with the eyes. You know, we far from the eyes right now.
Yeah, so that's why I went and looked back. I was like, well, let me go check just to be sure. Yes. So when I went and checked, I was like, oh, okay. It's question 44, report 22.
Yes, I know exactly what you're talking about. Because believe it or not, I had some people give me a whole page of stuff from the eyes. And I sent a nice little remark. We're not in this section, you know, so the whole thing.
I'm glad I looked it up when I did.
Yeah, so do we have any questions or concerns? Anything you all would like to know? Anything that is bothering you in reference to your daily assignments, your labs? You know, we definitely need to know about our bodies. And this is the perfect chapters, male and female, to just do a little more research to understand what is located inside of your body. You know, like I said on once before, like I said, we know the street names, but do we know really what's inside our bodies? You know, I mean, we need to know.
Those
Especially-
diagrams you were giving us, I was like, man, she's gonna kill us with these diagrams.
But I mean, it's good to know, just like with males, males should know what's inside the female body. Might give them a little more sensitivity as far as females on what we go through. Sorry, Jared, but I had to say it. Look at this.
Try telling my fiance that. Yeah.
You know, I mean, it helps to know, you know, the process that our body goes through with everything as far as delivering babies. You know, that's a serious process. And how the, you know, old school used to say, 1 foot on the table, 1 foot in the grave.
Mm-hmm.
It's a serious process. And then just to know, especially with medical billing and coding, you need to know what's going on in your body, what the codes are. And when it comes to billing, when you're getting a bill, when you've had a baby, you're getting a bill, you can look at it and see if they overcharged you. You know, just like when you go and you're getting medicine and they're giving you Tylenol and you say you don't want it, but then you see it on your bill.
Mm-hmm.
You know, you have to look at your bill because they're doing segments on the news and everything. They're doing a lot of overcharging. People never look at that bill. They let it go in collections. They don't worry about it. And you didn't even have those procedures done, but it's on your bill. And that's especially important for labor and delivery with females. They'll have
I'm
all
just gonna go
kinds of
ahead
pain
and say
medications and everything on your bill.
I'm just gonna go ahead and say this right now. Jared, I wish you could be us women for a day and see what the pain and stuff we go through.
No, thank you. No, thank you.
Jared said, no, thank you. Wow. See that? And that's what I'm saying, you know, it's good to know, and you should know your body as well as males in the male genital section. You should know all about your body, knowing what's going on, knowing the process, how things are digested in your body, what is really actually going on in your body. You should become familiar with that. This is a very, very, you know, you see, this was a longer section than the others because it's a lot that you need to understand and know what goes on when you all are going to be billing and sending out those CMS 1500 forms for payment to come back, for reimbursements to come back. You definitely need to know, you know, your bodies. Any other questions before we log off? It is 5:12. I'll be sending this to you all shortly. It's going to take a while, you know, for this to convert. But I'll be sending it out. Remember, your exam that's due on Sunday is chapters 18, 19, 20, and 21. 4 chapters, 57 questions. So please read through. I mean, it's not like it's a closed book. So you're going to have your books. You're going to have all the resources you need. It's just that you need to know what sections and what chapters and how to find it in your manuals. So look through those PowerPoint slides, look at the code ranges on where and what to look for, and then review what we did on Tuesday, review what we did today, because the things that we did review, these questions will be on your exam. So you all have a safe weekend. Remember, I'm off on weekends. You can email me. Do not text me, please. Do not text me. I'm saying this every day, and I get texts wee hours of the night, wee hours of the morning, Sunday morning, Saturday night. I'm
The only time I text you at night is it like when my computer went down that one night because I was in the middle of taking my exam.
Right, but even with that, that's dealing with assignments. I don't need to know anything about an assignment on the weekend. You can email me and then I'll see it on Monday. Now, just because, like I said, just because I'm checking assignments on the weekends doesn't mean that I'm going to respond on the weekends, because I do work on the weekends. I check assignments at my leisure. You know, I don't have to do that, but a lot of times I just go in and check assignments. If I'm doing something, I'm looking at TV, I might be checking a few assignments on Saturdays and Sundays, but I don't have to check any assignments until Monday. But I just choose to do that because it's so many, you know, and I have so many classes that I try to get ahead. So please remember, Sunday is the last day for any additional assignments being open. So please let me know if you need anything reopened. I will reopen after Sunday. On Monday through the last of the day, I will not reopen any assignments. Thank you all. Enjoy the rest of your day. Enjoy your weekend. Stay safe. And I will see you all on Tuesday. But I'll be sending out some more videos for you all to review. And remember, those extra points that I was putting in assignments when I was saying 10 extra points, 10 extra points. If you did complete those, if you want to use that as well, make sure you send it to me. Bye-bye. Stay safe.